Every year, thousands of children in Kenya face a life-changing diagnosis, and that is cancer. But outside the hospital wards and tough treatments, something beautiful is happening. At the heart of their healing journey, hope is being woven through art, music and creativity. Thanks to the Faraja Cancer Trust, children undergoing cancer treatment are finding comfort and courage through complementary therapy like art and knitting, helping them smile, express themselves and reclaim a sense of normalcy even in the most difficult times. Every year in Kenya, an estimated 3,000 children are diagnosed with cancer. The number is likely to be higher due to misdiagnosis. Leukemia, lymphoma, and other aggressive forms are some of the most common, but for many of these children, the battle doesn't start in the hospital. It starts long before. With challenges stemming from long journeys to treatment, misdiagnosis of symptoms, and insufficient infrastructure for diagnosis and care. Sadly, survival rates for pediatric cancers in Kenya are considerably lower than in high-income countries. Children with cancer are at risk of functional limitations and participation restrictions. But in the middle of this storm, there is hope. At the Faraja Cancer Trust, children undergoing treatment and their caregivers are discovering the impact of diversional therapy.
At Faraja Cancer Support Trust, our focus is on providing psychosocial support services to children who are undergoing treatment for cancer. And it also expands to cover caregivers as well. And so this is what makes our services inclusive. So when it comes to children, we have various complementary therapies that, as the word means, they complement the medical treatment.
When a child is diagnosed with cancer, they are not walking the journey alone. Family members find themselves internalizing complex emotions related to treatment, lifestyle changes, and decision-making. They also need this therapy.
So we started with patients who are admitted in HC, who are young adults and also teenagers. And then the program evolved to include even mothers of children who have been admitted in the hospitals. And this really helps in terms of relieving anxiety and also the depression that's involved whenever they're admitted for treatment. One of the challenges that we've also noticed is that initially the male population was not inclined towards knitting because of the cultural association of it being a woman's role or activity, but nowadays we are noticing that even male patients are involved.
The complementary therapy uses recreational, creative and leisure activities to help them cope with the emotional and psychological challenges of their diagnosis and treatment. Diversional therapy effectively reduces psychological distress, helping the children reclaim a sense of normalcy in the middle of medical routines.
We have beautiful pieces that were created as a result of a child being admitted. Yes, they are going through the treatment, they're going through pain. Some of them have fatigue and nausea, but out of this experience, they can get some form of comfort and relief as they participate in these activities. And then we also have weekly music therapy just to engage the kids and help them to feel a sense of relaxation even as they're away from home getting treatment.
Whether in individual sessions or group settings, diversional therapy improves the overall wellness of children and families impacted by pediatric cancer.